What's up, y'all? Welcome once again to Cello Effect in full effect. So it's that time. As you can see, I'm very comfortable. In my zone, in my setting. I'm getting my arm ready. This is Accept that I use because it's time to do dialysis for any of my new followers, anyone that's, hold on, I got a message. Anyone that's new to my channel, I'm a dialysis patient of 21 years, and I'm about to show y'all what I do to get connected. Oh, so I clean my arm first. What's up, Dale the Whale? That's my brother right there, part of the Green Machine team. If y'all don't know about Dale, yo, check out Dale the Whale on IG. That's the man to follow right now. He's on fire. So I'm just showing, because I did see that I got some new followers, dialysis patients, and they're curious about doing treatment at home. And, I mean, this is basically it. I'm getting my arm ready. This is my fistula. You're about to see me actually stick my needles in my arm. I hope everybody's doing well and good today. How are y'all doing over there in cyberspace, as the man TC loves to say? Okay, I do always advise to get your arm clean. You got to wash it with that special soap that your dialysis clinic gives you. After that, one of the only times I advise you to wear a mask. Put your mask on, glove up, because we do not want to get a blood-borne infection. I had one of those, and it was horrible. It was horrible. For 2 weeks, I had to go to the hospital for a week. And 2 weeks after that, at home, I had to inject myself with antibiotics through a PICC line. And it was not fun. It was very, very painful. So I use 15 gauge needles. I don't know if y'all know what y'all know about the gauges, but 15 gauge needles they're pretty big. They're very big. After 15 gauge is 14 gauge, and it's like the number's crazy. So let me just show you the size difference. See this pen? That's the needle, and that's the pen. So this thing is crazy, but first we got to do is take the scabs off. So you see how this needle has this little top right there? We just pick that off, and it's a little scab remover. So first, let's remove the scab. There's two different ports. The bottom is the arterial line. That's where the blood comes out and into the machine. And the top is the venous line. That's where the blood, after it's been filtered, it comes back in through the blue into our body. So just bear with me 1 minute while I take this off. It's like an annoying pain because you really got to dig in there to get the scab off. You don't want to get any you don't want to get any of the scab in your, in your wound, because you're basically opening up a wound. There's that. I love questions, so if y'all got any questions, ask away. Ask away. So I use this gauze to just, grab the little piece of skin that's left, so we don't get it in my body. Okay. That looks good. That looks clear. Now for the second one, the arterial. Nice. That one came off pretty smoothly. Good. Now all we do is take the scab off, pull. Let me show you here in a minute. Yes. So you can see the scab is now removed. And we got a little bit of blood flowing there, so now all I'm gonna do is just grab some alcohol pads, clean it up a little bit. And just sting a little bit, but it's okay. It's okay. It's okay. It's okay if it stings a little bit. It's okay. And now, first I like to go with the arterial bottom. So again, 15 gauge needle, but buttonhole needles. That means the tip is blunt. It's not sharp. And here we go. Boom. And now you can see the blood flowing because it's inside the tunnel. It's inside the vein. This is not a graft. It's a fistula. It's my vein and my artery that got connected. So now all I got to do is tape this up. Make sure that it feels good. It's not painful. We don't want it to be painful. I know there are many people that follow me that are interested in dialysis and they're interested in doing home hemodialysis, and they always fear that they can't do it because of the needles, and it's just like anything else in life, man. The human body, the human mind is so strong, it's so powerful that just like anything else, you will adapt, if you must. But I mean, even before you get to this point, take care of yourself. Be aware of what it is that you're eating. What are you drinking? What are you putting into this amazing body known as the human body and the immune system? I don't think we really understand how important it is to take care of ourselves. Anyways, so venous line now. And that's it. You see? And that's it. Make sure that it feels good. It's not painful. And I mean, basically I do treatment alone. Like, I do dialysis all by myself, After I was stuck with dialysis techs used to stick me when I was younger, and for years, a few times I got infiltrated, and that's very painful. So, I just decided to take my life into my own hands. It's all a decision that you have to make. And quiet down your monkey mind. We all have that mind that just wants to jump all over the place, to the past, to the present, to the future. And it's a practice, and it takes effort, it takes time to learn how to slow your thinking down, slow your heart rate down through breathing exercises, through meditation. And in turn, you'll slow your your brain down because of the heart, And that's very important for us dialysis patients to slow down the heart and relax, to just do as many things as we can do to de-stress the body, de-stress the mind, de-stress the system, because there's so much stress in this life of end-stage renal disease that it can be very difficult and overwhelming if you're not doing this consciously. So now we have to feed the blood into the tube. Saw that? Ooh, that was quick. And then make sure that it's okay. Everything's okay. Make sure that it feels good. To all my future dialysis patients, you can do it. You're okay. Just take care of yourself. Watch the blood. Watch the blood. Ooh. Be careful, man, because one time I didn't close that thing and blood just started shooting everywhere. And it looked like a horror scene. It really did. Watch it. Watch this. Watch how crazy it looks. Ooh. And then that's all she wrote. So real quick, let me show you my numbers and what it is that I do as far as the machine. So right here, my dialysate, my flow rate is 8.7. I'll be taking off, instead of 1 kilo, I'll be taking off, I just do 8.8 just because I like those numbers. And it's not as stressful on my body. I start the blood flow rate at 200 to begin with. So that's that screen. Now we press the toggle button right here. Boom. And then it takes me to, I'll be removing 30 liters. And instead of removing, let's say I have 1 kilo or 2 kilos on, instead of removing 1 whole kilo, because it would look like this if I had 1 whole kilo. It would look like that, 1 kilo. Let's say I had 1.1 kilo on, right? Instead of removing the whole 1.1 kilo, I reduce this to only 0.3. And when the 0.3 is done, the machine will alarm, notifying you that you pulled off all the fluid off. But mind you, I have 1.1 kilo. So what do I do when this goes to 0? And then my alarm, when it tells me that I pulled all the fluid off, boom, beep, beep, beep. I raise it back up during treatment to another 0.3. So I keep doing that. Because that's less stress on my heart. That's less just stress when it's pulling. Instead of just pulling all of it at once, it's just taking like little bits, little bites, little bit at a time until I pull off all of it. You know what I'm saying? All of the 1.1 or 2.1 or, etc. So, and then I'll raise my blood flow rate to 380. So this is gonna go up to about 380. No, I'll put 370. I'll put 370 for about an hour in the treatment. Then when I have 2 hours left, I'll reduce this to about 330. Then when I have 1 hour left, I'll reduce this to 290. Then when I have about 30 minutes, reduce it to 270. Then when I have 10 minutes, I reduce it all the way to like 240. And there you go. Now, that's what I do. And that's what anybody can do. Just talk to your dialysis team, talk to your doctors and let them know. But this is a great way to, just make your treatments not so hard on your brain and on your body that you don't feel so stressed and just so out of your mind when you're done. And then that's it. That's it. All I got to do now is connect. I'm about to go give me my food because I got some food warming up because I love, the machine makes me so hungry. I love to eat. So I just, I always have my night meal on my machine. And that's it, beautiful people. Again, I always like to leave y'all in saying, if you have questions or if you if you want to talk to me about anything, by all means, hit me up. And this is because this is what I'm here for. You know, I've experienced and I learned so much over the years that I really can help you. But it's up to you to be able to want to learn and apply what it is that I'm saying. And that's it. Thank you so much.